Assalamu alaikum, good afternoon, and welcome to Family. My name is Abdul Rahman Faruqi, and I'm your host. I've done a lot of live shows for you guys regarding registration, regarding stigma and community pharmacy, and all the other shows, obviously. And we bring you a brand new series on pharmacy practice. So the idea was to be able to share what other pharmacists are doing around the globe in different capacities, and one of them is the prison services. And we've talked about other services, hospital services, community services, but obviously it's a very, very unique practice that pharmacists are working in prison. And thank you very much, guys, for joining us and staying online. And I would like to begin first by apologizing by coming. Obviously, it's 24 minutes. We are late because of some technical issues. And to begin with, obviously, I just want to say that I'm in Pakistan now. So you guys can approach me. I'm based in Karachi, and I'm here in Karachi for a few weeks, and that's one of the reasons why I took so long before I've organized this session, because I wanted to spend some time with my family. Right, so we formally begin our session, and I would like to first thank Faculty of Pharmacy, University for Women, for their continuous collaboration with us, and obviously their students are participating, and you guys, family, and all those members. You guys always look after us, look forward for our shows, and try and learn as much as you can. And obviously we try and bring something new for you every single time. So obviously we bring this opportunity for you to learn through our sessions, and also ask questions you may have, in our live sessions. So once again, thank you very much for staying online. I would ask you to share this video in your groups and on your timeline so most people can see it. Obviously, your pharmacists and your colleagues would most probably be pharmacists as well. So, and then also people who haven't subscribed to Family and followed our channel, I would request them to follow our channel, like our page, and also share the word. So we will keep on doing the marvelous and great job that we're doing. And thank you very much for your appreciation. So right, to begin with, today's show is, as you've seen the poster, it's about pharmacists practicing in prison services. What do they do, and how does it feel like to work in prison? It's a completely different world. And I've got a lot of experience working pharmacy practice, but I must say I've never worked in prison. So this is going to be a learning curve for me and a learning opportunity for myself as well. So that's why I've invited our guest. And because of some obvious reasons and security reasons, obviously, didn't want to come up on the screen with the live camera. And that's why he would like to use his anonymous name, Mr. Smith. So during the whole program, I'll be using his name as Mr. Smith. And he will be putting some light on his pharmacy practice career, and also particularly about the pharmacy services in prison. And what does it require for a pharmacist to work in prison? And how does it feel like? Is it safe to work? I've got a lot of questions for him. And our session is not going to be, an hour session because of the time commitment. And obviously, it took us a good few minutes before we began our session. So, but we'll try and answer as much as we can, and to ensure that you'd have this learning opportunity, and you'll take something from here. So brilliant. So Mr. Smith is a pharmacist in the UK. He's practiced in community pharmacy. He's practiced in hospital pharmacy, in clinical setting, in medicines management. He's got a lot of experience working for mental health pharmacy. Again, it's a specialist role. So hopefully, he will also come and put some lights on mental health as well. And obviously, in addition to those experiences he had also worked in prison services. So before any further delay, I would like to welcome Mr. Smith on our show. So let me just put him on the screen. 3, 2, 1. Hello, Mr. Smith. Welcome to our show. Good afternoon.
Hi, Mr. Faruqi. Thank you so much for inviting me to your show.
How are you today? So I would like to begin by requesting you to, just to give a background about yourself, about your experience, and which, I could only tell what I knew about you. Obviously, worked together for a number of years, but it would be good for the viewers to obviously listen from your end.
Obviously, we have worked together. For my background experience, did my pharmacy from Pakistan. First of all, let me tell you, I'm actually not a Mr. Smith. This is a pseudonym you have given it to me. It's obvious just because of some security reasons. So I did my pharmacy from Pakistan. Then I came to the UK and completed one of the masters in pharmaceutical sciences as well.
Mm.
I couldn't like that field. I would have to switch to my goal. So I converted as a pharmacist. So work in the UK for about so many years, about 15, 16 years. So I worked in about 15 trust and NHS trust, and I have worked in 5 prisons actually. So all different prisons I have worked in, like, from starting from category A prison to category D prison. So I have worked in community pharmacy for all of different multiples like Lloyd's, Boots, and Roland's. All of them have worked for them. This is my little bit introduction. I know we are short with the time actually, but we have to stick with our main conversation.
Brilliant. So, tell us a bit about like what is required to get into prison services, because I found myself, I applied a couple of times, I wasn't lucky enough to get into prison services. I know, and also I think it's a really well paid as well, isn't it?
Prison services, prison pharmacy is. Let me tell you about how the prison pharmacy work. Every prison have like human rights actually for the prisoners. So we have to supply basic health facilities to the prisoners. So in all prison they have a like of health care. In
Mhm.
prison we have pharmacy, we have mental, we have doctors actually, we have nurses for 24/7 for the prisoners health care actually, and then we have a physiotherapist, dentist, and all of the people are working in the prison in one set environment, which is called healthcare center. So in as the question that you have asked me, how do you get in the prison? Yes, the first thing I will say, as you mentioned, you are not lucky. So first of all, you have to be lucky to get into prison. There are two ways to get into the prison. Either you have to be very lucky, like I was very lucky that time because I was working as a locum. I got a call from agency. Okay, do you want to work in the prison? They don't need anyone who's a security clear, because to get into the prison you have to have a security clearance, and you to get the security clearance you have to have the job in the prison sector. Otherwise, you can't get the security clearance.
Ah. So
So
just to remind from my understanding, the first, you need to have enhanced security check to work in prison,
enhanced
and
security checks is different. Security clearance is different. All
right,
everyone who
okay,
has to work in the prison, we have a sector called norms. They do the security clearance check. So
right,
different kind of clearances for different prison. For example, Cat A prison get enhanced security clearance, and then it
right,
says category B and C comes to the just the clearance, normal security clearance. So for category A prison, you have the prison the clearance usually take about 6 months, and for category B and C and D clearance, that usually take about 6 weeks. So they check everything about your background, each and everything. Obviously, that's a high risk area. They have to check each and
right,
everything. Even they check your background, where you come from. They do the check from that background as well. So that's their job. So to get into the prison, you have to have a security clearance to work into the prison. Otherwise, either you are as a work as a locum, is very hard to get into the prison to get a security clearance. So you have to take a permanent job into the prison. So prisons are different kinds of services. Some comes under NHS actually, and some comes under as a private sector. For
right.
example, Forest Prison, and then Practice Group actually, which used to be a different prison. So just to get you that idea, how do you normally get into the prison? Not
Right.
into the prison is like working into the prison.
Right. You mentioned about hiding your ID. Obviously, I do understand a little bit, but not fully. I mean, what would happen if you've shown your ID? Obviously, why are you hiding your ID? I mean, would you be able to explain, put some light on it, just a little
Um,
bit, please?
the idea behind, and most of the prisoners are very masters of manipulation. So
Uh,
prisoner can find your details online, personal information online, then they can blackmail you, your family, just to get what they wanted. For example, prisoners can say,
uh,
I need this phone, I need mobile phone, you have to get me that phone. They can manipulate you. You get me? They can blackmail you, and they can find your address, they can
uh,
come to your address. So we have to be very careful. Even when I put something online, I have to be very careful. I never show that I have worked in the prison sector, just in case it's
right.
the same for me and for my family actually.
Yeah, it reminds me of Prison Break. So the series
That's
on
correct. Yeah.
Netflix. Right. So you mentioned about how you entered this sector, and you have to be lucky, or you know someone in prison sector, or you have a permanent job. That's a different one. So how is prison like in terms of working atmosphere? What sort of service that you provide? For example, if you work in community, the services are essential services, advanced services, work in hospital. It's mainly the clinical services or education and training and the other services that we give. How does that? Is it more like addiction services or substitution services, or
Um,
is that just a repeat prescription? How does that work?
it's exactly the same like the way you work in the community pharmacy, but we have more
Right,
involvement of the substance misuse actually and
right,
antipsychotics. So
right.
all prisoners, most of the prisoners, they take methadone for their substance misuse.
Yeah,
So what they will do, in the dispensing side, if you see, there are two kind of dispensing we do in the prison sector. One is called in possession, and second is not in possession, and that depends on the risk factor. We have to do the risk assessment before, and before giving any access to the high any medication to the prisoner, even for like buscopan. That's banned in the prison because they can do something to make a highs for this with the buscopan tablets even. So they crush the buscopan and mix it together with the sugar and makes high with the buscopan tablet. So this is the
right,
first example. So the kind of dispensing as we are talking about is a dispensing like in possession dispensing. The prisoner can keep in their cells actually in their room.
mm,
And then that second one is called not in possession, which is like they come to the hatch into the to the pharmacy department. They have a separate room in each cells for the pharmacy. So they come to the hatch and they get their medication in front of a qualified person. It can be a pharmacy technician who are mostly doing the those administration of medication, or nurses actually. So for the control drug, you have to have two people at the same time to give to the medication to the prisoner. So, for example, if somebody is having on methadone, there should be having two checks before giving any medication, just in case to eradicate any error. And for example, if somebody is taking any tramadol, pregabalin, or methylphenidate, there have to be two checks actually. So in that case, let me tell you another thing. When we do, when they give the methylphenidate, anything like that, that's they can conceal the medication and they can
mm.
sell it to the other prisoner. So just to avoid that one, pharmacy technicians or any nurses, they can challenge the prisoners to show their mouth. So that's very technical area, and that can be very aggressive for the action. And so, but we have to be very calm at that position. We have to say, this is our job we are doing. At the end of the day, that's the security of you and for us as well, and for the different prisoners. So in
Right,
the
brilliant.
dispensing side, as a pharmacy side, as a pharmacist, pharmacists, and most of the pharmacists, what they run the clinics actually. For example, warfarin clinics, and for example, nicotine clinic, and smoking
Mm.
cessation clinic, and different kind of clinics pharmacists always
Mm.
run. But nowadays, as you heard that most of the independent prescriber pharmacists are involved as well. So they run their own clinic and in the prison sector
Is it not
alongside with the
dangerous to run
doctor.
your own clinic in prison and seeing patients like face to face? Because I don't know whether there will be, when the patient comes to you, will they be cuffed or would they be with the police constable, or how does that
Uh,
work?
Obviously, and it's a two-way benefit. They when they come to have something like from you. When you check the prisoners, obviously they come there for their own benefit, but you don't know their state of mind. They can
Mm.
attack you, but we always have backup. When they come to the health sector, health clean room, health center, that room is always locked. The main room is always locked. If there anything happen, we always can pull up the our alarm, and within couple of seconds, the officers always with
Security.
us. So security officers are always at the door, and even if we have any attacks, it's anywhere in the prison. If you pull your alarm on, the security can come to you within 10 seconds. So it's at the end of the it
Uh,
depends. It depends what other person is state of mind. They can attack you, but you have to in prison. Which I learned that you have to have your sixth sense working very closely. So you need to look
right.
different ways. For example, if I know that different people are standing there, I would always avoid that congestion unless I have very good reputation with the prisoner. So I can say yeah hello to at them actually, but I always avoid where they are normally standing because you don't know what's gonna happen in next second.
Mm. Is it dangerous for female pharmacists to work in prison?
Absolutely not. Actually, for the
Right,
female,
okay.
it's very safe because they give more respect to the females compared to the males. That's why I noticed because in most of the prison, I have noticed that the nurses of most of the nurses, almost 95% nurses are female.
All right, okay. 95% nurses are female. Right. And you mentioned about the prisoners have some categories, has been the way it's categorized. So how would you categorize prison pharmacy services?
Prison and different prison has different categories for depending on severity
Sorry, you're breaking
of
up.
the
Can you
risk.
repeat that,
For
please? Sorry,
example, category A prison,
Salman.
if you use Manchester,
John, Mr.
obviously
Smith. Sorry. Hello.
for the
Hello. Can you?
HMP,
Hello,
is it
Mr.
break?
Smith. Can you hear me? Hello. Yeah, I
Can you
think I
hear me
can hear
now?
you now. Yes. Can you repeat that, please? When you started saying about the
Yeah, I
different
can hear you.
different prison have different categories. Can you mention that again, please? You're breaking up there.
Yes. So as you from Manchester, as I'm the example, local prison,
Mr. Smith, I can't hear you. Uh, hello.
able to have enhanced prisoner security clearance, which can you hear me?
Sorry, I think you're breaking again. Can you repeat the same thing over again? You're mentioning about different prison have different categories, and then you got cut off. Hello. I think it's because of some technical issues. We're not able to hear Mr. Smith. Hello. Can you hear me? Right. Guys, just bear me 1 second. Let me just call him and see if I can ask him to join me via voice. Um, are you able to join us from here? All right, 1 second. Let me just put a speakerphone. 1 second. Right, so Mr. Smith is joining us from mobile phone. Let me just put a speakerphone. Can you guys hear all right? Do you wanna speak now? Because I've put a speakerphone. Hello?
Hello, can you hear me now?
I can hear you now, viewers. I would really appreciate if you can type a message and say if you can hear Mr. Smith via phone. And if somebody can type a message and say if you guys can hear him, okay?
Can you hear me, guys?
I can hear you. I'm not sure whether they can hear you. 1 second. Yes, that's fine. I've got her. Yeah, go ahead. So you mentioned about different categories in different prisons.
Yeah, so most of the prison sector in the UK is categorized category A, B, C, and D,
Right.
depending on the severity. So category A is our HMP Manchester. That's the first example. Category B is a HMP Oakwood and Wolverhampton, and category D, C, and D are mostly in the Sudbury. Category D is basically open prison, which you'd be surprised to know that the prisoners over there can go outside, they can work outside, but they have to come back to the prison.
Right. Okay.
So for category A prison, that's very high secure prison. So if you have go through the whole airport security, it's like the same security in the category A prison. So you have they check each and everything. They do X-ray on you. They check each and everything on what you are carrying for the food actually. But there are some things we can't take it with us when we go to the prison sector for working in the prison sector. So you have to be vigilant what you are taking. For example, anything steel stuff you can't take it. For example, if you're carrying any forks, it has to be plastic form.
Right,
so
okay.
You can't take it.
Right. So that's done on a daily basis. So if they know you're working every day, that's still they will still check you. Yeah.
For category A prison, yes, they do the checks each and every day if you're going into the prison sector.
Right.
For other prisons, they do the spot checking on you.
Right.
Some days they do the checks, and some days they don't do the checks. It totally depends if you have because they always have intelligence inside, and they can get information from inside if somebody is carrying anything inside. So they do the spot checks on you, and obviously there's a if they found you guilty, you always end up in the prison.
You always end up in the prison as a prisoner, not as a pharmacist.
Not as a pharmacist, that you have to be as a prisoner.
So tell us briefly about the role of pharmacists. Obviously, this is why we are here to discuss. For example, day to day, you walk in, you've gone through a security check. You mentioned why you're hiding your ID. And so when you go in, like, how do you start? Do you put your RP certificate? Do you log in somewhere? Do you take charge? And how many pharmacists are required to be in pharmacy? And is there someone who works with the patient in prison, someone who works in pharmacy? How does that work?
So first of all, when we go there, go through all of the security checks, then what we do, it depends. As you mentioned, the responsible pharmacist RP login signing is totally different. For example, two kind of prison services are there. One is NHS funded, and second one is private sector. Most of the private sector prison, what they do the outsourcing.
Right.
They do the outsourcing. They get the medication dispensed from like Wells Pharmacy, Lloyd's Pharmacy. They get the contract to outsourcing.
So the private prison services, the private services group, they outsource the dispensing services to community pharmacy outside the prisons, yeah?
That's correct.
And they get the delivery over. So basically, they send electronic prescription or manual prescription to pharmacies and get them packed up and then get it delivered back. Is that what they do?
Yeah, but when we do the outsourcing, we don't send out electronic prescriptions. So all of the prescription we fix to the local pharmacy,
right,
unless it's a controlled drug. So what we do when they send the controlled drug back to us, we give the original copy to the driver. So that's just to keep the legality. So if we are working in the NHS prison where the services are provided by one of the pharmacy sector, so what we do, we go and signing as a responsible pharmacist, and then the system we are using in the prison is the system 1, which most of the GP practices are using as well. Yeah. So we sign in as a responsible pharmacist, and then prescription doctor write the prescription, and we do all of the clinical checks actually before printing the prescription for dispensing. So as you work in the community pharmacy, you have noted so many interactions, contraindications. It's the same procedure which we follow in the prison actually. So just to make the safe and safe service, safe medication provided to the patient. We don't treat, obviously it's a prisoner, we don't treat as a prisoner. They're like our patients.
Right. Okay.
So we don't have a close relationship with them compared to the community pharmacy, but we give all of the high care service to the prisoners.
Right. So right.
So,
okay.
Then basically pharmacist's job is to do the clinical checks in the pharmacy. Then we have a technician sitting with us, healthcare and dispenser as well, who dispense, and the accuracy checking technicians as well. So sometimes the pharmacists always check the medication when they are either the short stop or there's any control drug to be checked, because accuracy checking technician, they do the control checking, but as most of the department prefer the pharmacist because the control drug.
Right, guys, just to mention or enhance you for the purpose of enhancing your understanding, accuracy checking is something that one of your dispensers dispense something as per prescription. That they're asking for ramipril, simvastatin, amlodipine, or anything else, Zopiclo, for instance. Then dispenser would dispense these prescriptions, label them properly. Accuracy checker or checking technician would match those details and sign against the prescription to make sure that the dispensers dispense correctly. Pharmacist's job mainly is to ensure that all these 4 drugs can be given to that patient safely. If there are any interactions between them, is there any contraindication between them, is there any cautions, and is best suited for this patient based on the patient's stats, based on basically customizing the patient, that he's overweight, for example, and if they're giving him sulfonylureas for diabetes and they're already overweight, knowing this causes weight gain, that's like customizing patient to patient depending on what they do. So pharmacists do the exact same thing, getting involved in clinical aspects of prescription rather than accuracy checking or dispensing. So also one of the other questions.
Let me add something more into what you're saying and continue from there. what the pharmacist's role in there? One is they involve in more of the multidisciplinary team meetings as well with the doctors and other clinicians.
Yeah.
What they will do, they just sit down and discuss the patient's cases and what the best way to go with them. So that's the main thing, because multidisciplinary team is basically for if somebody is on very high risk medication or very high risk antipsychotic, that we sit together, we make a care plan for the patient. So what we can do with the medication, either we can prescribe or increase the medication. So that's another job of the pharmacist, which is very important as a part of pharmacy services.
Yeah, so that's really good to mention those things. Pharmaceutical care plan means pharmacists are actually involved in treatment plans. So it's not just like supply service where you get the prescription, you get these prescription over to pharmacy and get the drug out. So as a pharmacist, as Mr. Smith mentioned, that these things obviously happen in collaboration with a multidisciplinary team where you're involved in decision making, where you know what the treatment plan is, what's happening for this patient in the long term, and then what's the background behind these rationale. Can I ask you one question moving forward, obviously, before we move on to next question? You mentioned about private sector and the NHS sector. So what in terms of percentage that we look at, see the private sector is 50% or less prison services they're managing, or NHS is managing 60% or 70%? How does that work in prison services?
Private sector is more than compared to the NHS because obviously they have more funding because they are private sector.
Right.
If you compare, for example, if you must have worked in the community pharmacy so long period of time, you must know there's a funding cutting, but that's not the case with the NHS because our funding is not from NHS. Our funding is through Ministry of Justice. So we have more funding, but private sector, they have their own funding and they can provide the services better compared to when we have to wait for funding from different sectors. So when comparing to the percentage, what I can see is the 75% is the private sector.
75% private sector and 25%. Right. Okay. NHS. Brilliant. Right. Moving on to the next section, how pharmacy operates.
I didn't get you.
Operation, in terms of operation, obviously, different. You mentioned about categories. You mentioned about pharmacist's role. I just wanted to know about the operation. For example, when you go to community pharmacy, majority of the community pharmacy would have one pharmacist and dispensers and technicians, assistant, counter assistants. So in prison pharmacy, is it similar to community pharmacy, or do you have more than one pharmacist, and do you have pharmacists working with prisoners in there somewhere in the clinical setting, and some of them staying in pharmacy? How many, like in terms of operation, how does that work? Is it 24/7 that you provide service, or is it long hours, short hours, weekend?
No, it's not 24-hour services. Mostly the pharmacies are 9 to 5.
9 to 5.
And then if you compare how many pharmacies, the question, it depends what size of prison is. It is because some prisons, for example, Manchester is about 1,000 prisoners there, nearly 1,000 prisoners. So you definitely need 2 pharmacies there, and then plus you need ACT, then you need the dispensers.
Yep.
Then the pharmacy technicians are involved in the topping up procedure as well. It's the same like in the hospital. They go to the different wings, different cells, and then top up the medication, which is like a stock only medication in the cell in the prison. So it depends size of the prison actually. So there are some prison actually who are like Sudbury prison, which is about 400-500 prisoners there, so they don't need that much quantity of the pharmacists. So it totally depends where you're going and what size of the prison is.
Is there any on-call pharmacy service for prisons?
No, there's no on-call services for prison, but there is on-call services for the nurses.
Right.
For example, if there are some prisons, for example, HMP Dovegate, which is like 24/7 as healthcare sector, but pharmacy is not 24/7. After 5 or 6 o'clock, nurses are there overnight for the care of the patient, because it depends what kind of dosing you are doing, because in most of the prisons are twice a day dosing, and there are some prisons who do 3 times a day dosing, morning, lunchtime, and nighttime dosing. So it depends. I have seen most of the pharmacy technicians are working overnight as well. there's no discrimination like who can work or who cannot work. But most of the pharmacy technicians who do the jobs of as in nurses actually. So basically administration of medications and nurses job, but most of the technicians are doing it as well. And then if you're talking about pharmacy services, when any prisoner come to the prison, what they do, they go to the admissions room first, and then one of the pharmacy technician, and they do the medicine reconciliation.
So history taking similarity is going to be similar to what we do in hospitals. Is that right?
That's correct.
Yeah.
That's
so we do the history taking and we do the
medicine.
medicines reconciliation.
Yes, that's correct. That's
For all new prisoners. Is that right?
For all new prisoners, anything coming to the prison sector, any prisoner, and they have to do the medicine reconciliation for that prisoner. And then once they do the medicine reconciliation on the system, they send a task to the GP to prescribe the medication and let them know how many. Sometimes when they come from the different prison, they always come about 7 days or 14 days supply. So if anything new, anything they don't keep it, they always task the doctor to prescribe that one so that can be arranged for that prison.
Right. So you mentioned about GPs. So prescribers are also present in prison, isn't it?
That's correct.
So why would you need the GP to prescribe their regular medications?
So there's, if you see in the healthcare sector, in the health center, there are always about 5-6 GPs sitting in there.
Right.
So there are more GPs compared to the pharmacist.
Right.
So unless there's an independent prescriber pharmacist working as well, and he can sit together with the doctor and he can work with the doctors in his areas expertise again. And it's not like they can choose, but they have to work in the area of expertise. Another thing which we know that the pharmacy technician do, they do the spot checks in the prison cell. What, for example, if the prisoner is given in possession medication for any medication, for example, sertraline or citalopram, let me tell you example. And what they do, they go, for example, they have given 28 days medication 14 days ago. They do the spot check, and the prisoner should have 14 days medication left over. So if they are short with medication, they remove the patient from in possession and send a message to the doctor. This patient is either concealing or selling it to the other person, or whatever they are doing. They take it from the medication from in possession. They can't keep in the possession unless risk assessment is done again. So it depends. It's revolved around the risk assessment in the pharmacy.
So you mentioned about possession of drugs, right? So possession of the regular medications. So are they not locked up like in hospital? We have the bedside cupboard where nurses lock their own medications. So in prison, they have the possession of their own medications. Is that right?
Yeah. So when we do the possession, it means the risk assessment is done on the prison, and he is fit to take control of his medication. He is responsible for his medication that he's taking because they have to sign the risk assessment actually. Right. So anything happens, anything shortage with the medication, he knows that he will be liable for the consequences.
Right. And if you talk about clinical governance, section like in hospital, we do DATEX, we do reporting of anything happens with medications, incidents, and that have potential to cause patient harm or that has caused patient harm. So we DATEX those incidents and then we review them, what sort of incidents happen, if it's prescribing related, if it's medication dispensing related, if it's that, something that you may miss out and there was an interaction, you didn't catch this. So what happens to the patient? Because at the end of the day, they are patients, but then they are in prison as well, So how does that work?
Because in the health clinical governance side, it's very big area now in the prison sector. So anything, because it's a high risk area, and so they are patients for us. So any harm to them, we have to report to the Ministry of Justice. So we have to report to the all of the areas actually, and then complete the DATEX form on site. So any we can find out what's happened, how did happen, and any we can be avoided in the future. Right.
So you do have DATEX system, and you do have reporting, and so you do have you should have a lead pharmacist as well, isn't it? Who makes sure. Do you have chief pharmacists in prison?
if there's NHS prison, there's always a chief pharmacist who is a band 8 C or D,
Right.
and then there are band 7 pharmacists actually, then band 6 or same category as NHS.
Right.
So if it's a private sector, then it's a responsive. They always have a superintendent pharmacist covering the one region actually. So for example, Southwest region, they have a superintendent pharmacist who's responsible for all of those prisons. And if a pharmacy related incident, we need to report it to them. Again, if it's offsite, if we are sending the medication offsite, then they only have their own procedure, and whatever they do, they have their own superintendent pharmacist. So all pharmacy sector, they have superintendent pharmacist. Then most of the if they are offsite pharmacy, there's a pharmacy technician who's a chief pharmacy technician,
Right.
and that person is responsible for everything. So private sector, chief pharmacy technician. If it's NHS, then it's a chief pharmacist.
Right. In terms of payment, what sort of pay is it similar to community pharmacy? Is it similar to hospitals? Is it more pay, better pay, and how does that work?
If we compare the pay, NHS is the same pay scale, whatever you say in the hospital, band 6, band 7, band 8, it's exactly the same one, and the benefits are same. If it's a private sector, they usually, it only depends on your negotiation actually. So you can most of the prison advertisement I have seen, they're starting from 40,000 plus.
All right. Okay.
Because it's
pharmacists.
It's a high area for the pharmacists. Yes.
Right. So I think it's better than hospital. Then 40 means it's very close to 42, which is 44, 43, which is nearly band 8.
Yeah. So if it's a private sector, you can say they're matching the community as a community pharmacist.
Right, guys. I think we should wind up here, unless you have something to add, Mr. Smith. Do you have anything to add now? I think I've got the list of questions finished. So unless you have anything to mention, I would like to ask you. We have a few questions coming through. So I think unless you have something to add, we will move on to the question answer session, because our time commitment was between 5 and 6. But because of the delay start, I'm not sure how flexible you are in terms of extending the time and how many minutes further. We are getting a few questions from the viewers and family members and students of Faculty Pharmacy, University for Women as well. So do you want to add something before we finish?
I would say I expect the same kind of healthcare sector in Pakistan actually, but I think I don't know what kind of sector we have. I don't know if we have rehab section there or not, and how we are working on it. I think this kind of things we should be having, because at the end of the day, obviously they are there for a reason for us, but they are a patient. We should treat them as a patient, and we should give the high level of healthcare to them. Which is a normal human right for everyone.
Yeah, we have a duty of care for them, isn't it?
That's absolutely right.
Yeah.
Yes.
Right. Okay, guys. Let's move on to our question answer session briefly. So we'll be taking a few questions before we finish, and then before we finish, we'll ask you to, pass a message. It can be anything relating to professional advice, work, or just the message from guests to see, you want to say something. It can be work related, it cannot be work related. Any message would do. So keep that in your mind before we finish. Right. So take our first question for today. Is this coming on the screen? If you can see it, if the pharmacists do the psychological counselling of patients in prison, are they involved in the counselling of patients, particularly psychological ones?
Pharmacist is involved for almost everything. If the patient is in the state of
you said involved in everything.
But so if the patient is in that state of mind where they feel depressed, so that's as a professional, that's our responsibility to encourage them, to take them out of that state, and what we can do for them. So we have to look for a step further. So how can we help them? But basically the question psychological is basically psychiatrist's job to do it. So what the pharmacists can do what we can do in our limits, because we have boundaries for each person.
Right. So the next question is, how can we work in a pharmacy without being licensed in the UK and Pakistani license? Right. So that's a question. I would like you to answer this because I've done it so many times.
In the pharmacy sector, I would say no, because you have to be a registered pharmacist first or registered pharmacy technician. And in the UK, so it's not possible, unfortunately. But with Pakistani license, I think you can't work in the community sector even in the UK.
Right. Okay. Right. So there's another one here from Sundar Sayed. Do we have experience managing on the job disputes between technicians? I'm not actually understanding this question. Do we have experience managing on the job dispute between technicians? Are you getting
I
this?
think that meant to say if the different technicians are working different ways. So as I mentioned that chief pharmacy technician is basically the responsible person for just for the pharmacy in the prison.
Right.
So we have different categories for the technicians actually. So it depends. We have band 6 who is a chief pharmacy technician, then band 5 and band 4. It depends on their role. So band 5 are basically mostly involved in the medicine management sector, like medicine reconciliation, admissions unit, and they involved in more. But band 4 are mostly involved in like you can say administration of medication. So it depends what's your banding, and then it's been categorized according to the banding, and then we come to the dispensers, then healthcare assistant actually. So it depends what kind of banding you are.
Right. Okay. And then again, the confidence as well. So if you show the confidence, right. I've got a question here. How do you manage drug addictive patients, like the substitution service, and obviously in community? I'll just briefly mention what we do in community and hospitals. If we have a hospital, a patient comes into the ward and admitted due to any other reason, and it tells us that he's also getting methadone or buprenorphine for substitution service, then in hospital we follow the process of contacting his addiction clinic and also contacting his pharmacy, regular pharmacy, where he picks his prescriptions up to see whether they have his regular prescription and is he there collecting every day. Is the dose supervised or is the dose non-supervised? Supervised means he has to go to pharmacy and they ensure that he drinks that dose. Unsupervised means he goes to pharmacy and collect his medication and take it with him. So, this is the difference. This is what we do in hospital and community. So similar questions relate to you, Mr. Smith. How does that work? How do you manage substitution service in prison?
In prison sector, we have a separate team which is called substance misuse team.
Right.
So any person who's coming with the methadone or buprenorphine or anything for ADHD medication, we continue with the same care of treatment. We try to reduce the methadone to encourage them to reduce it. But as you mentioned, in the community, you have the flexibility for supervised and not unsupervised. But in the prison sector, we don't have that flexibility. They have to come to the head, like their medication, and drink in front of us. So, and then make sure they have drink it, all of them, not keeping in the mouth and not throwing away and giving it, sending away.
So which means, obviously, AB, in terms of the role of pharmacists and the pharmacy team, it's more challenging because you're actually supervising every single patient or prisoner when it comes to substitution service, isn't it? Is that right?
Yes, that misuse service is basically nurses are involved in that one. But when it comes to the administration, pharmacy job is to supply methadone to the relevant wing, and then pharmacy technicians are involved in giving out medication alongside with the nurses, and they can encourage them if they want to reduce the medication, and once they accept the reduction, they send a message or task to the substance misuse. This person is agreed, he wanted to reduce it, come out of the medication, so we can make a plan for them. So pharmacy is involved everywhere.
Right. Another question is, what is the role of pharmacists in the treatment chain? I'll let you answer this question.
I think that the treatment chain means what's the role. First thing, we supply the medication. We need to ensure that all medications are suitable for the patient and dose is adequate for the condition, and there's no interaction, there's no contraindication, and we have to save supply of medication. That's the first role. Then pharmacists come to run the clinics, so involved in the rehabilitation center actually. And then it depends what your role is, what level of job you are working. So it varies. The treatment chain varies from with the role actually.
I've got a very good question from Zafar. He said, how this job interacts with your social life? That's kind of maintaining the work and the life, the balance, basically.
This is the very good question, which I say, and I haven't mentioned in previously. When you are in the prison, you are cut off from your social life.
Yeah.
So you are in the prison from 9 to 5 or 9 to 6 without anything. You're not allowed to carry any mobile on you. Yes, you have the phone, which you can use it from inside to contact with your family and friends, but obviously you haven't got any contact with outside. But you can only leave your mobile in your car around 7 o'clock in the morning. When you go out at 6 o'clock, that time you can check everything. But obviously your social life is totally separate when you are in the prison sector.
So especially now, we are so much addicted to the social apps, Facebook and all these applications, and they're not having to use them throughout the day, or I would say most chunk of the time. It's quite, I think it's good in some way. But obviously you said if your family wants to ring you, they know what number you're on. So it's not like they can't reach you, isn't it?
No, they can reach us, but it's a proper procedure. They need to go through the reception. Then the reception, what they do, all prison have called Hotel 2. So Hotel 2 is like a supervisor in the prison. That's always the nurses. They contact them, and then they try to find us, because we always carry radio with us. They can say, where are you at the moment? So this could be, okay, we are on this number. Then the reception transfer the call to us. So if one person is saying, okay, I can go and chill inside, but that's not going to happen. You are totally out of social life. You are totally out of the world. That's a different world inside, where you are just there looking after the patients, and then you have to look up for your mental health actually.
Right, brilliant. I've got another question here. How did you get this job? I mean, what is the criteria to get it? You mentioned about being lucky, because the agencies have approached you to see if you wanted to work. But if somebody wanted to work in prison, how, I mean, is there any website that advertise these jobs, or how does that go?
Yes, that's correct. They are at job website actually, nhswebjobs.com.
Right.
That's the one, NHS job. That's the first one if it's an NHS prison. And most of the private prison, they always advertise on that site actually. Once you click on the job role, that will then direct you to the private sector website, and you can apply. There's no hard and fast rule to get the job. It totally depends what skills you have and how much you can give it to. Obviously, at the end of the day, it's a survival of the fittest. So you have to be different to get the job. I know it's not, there's so much saturation at the moment, but there's still roles available. People are still going inside. That means they have different kind of skills in them to give it to the prison sector, and so that they can employ you.
Right, brilliant. So we wait for another question or two before we finish. So I would request, what's the useful material? All right, okay. So another very important question I would say is, let me just put it on the screen. What is the useful material for prison interview? Because obviously people not having to work in prison previously, it'd be very difficult for someone to prepare for an interview to see what sort of question you'd be expecting. So what do you think? I mean, were you interviewed when you got your first job, or did you get it through other work as a locum?
As a locum, no, not at all. But I have been interviewed for one of the band 8A job.
Right.
But it's entirely the same interview where you ever go, for example, tell me about yourself, how do you bring the change, what's your expectations, and what's different you have. Then it's a conflict resolution question.
Yeah.
And it's almost similar questions. There's no entirely different questions. They say, okay, no, you need to do this one. There's no different. It's exactly the same template what you use for other jobs.
That's brilliant. Right, guys, thank you very much for your questions, and thank you very much, Mr. Smith, for a very, very informative session. And I really enjoyed it because obviously not knowing nothing about it and obviously having discussion and unilateral or one-side information, it was really useful and a learning curve for me. And I'm sure you guys have enjoyed it as well. So what we do normally now in our sessions, we ask our guests to give a take-home message to our viewers and family members. So it can be anything really, it can be anything relating to pharmacy practice or general motivational advice or anything that you think is important. So what advice or what take-home message would you like to give, please?
My advice to all of you is nothing is impossible. If you have drive to do the things, then you can go. And so if you have more your mind, I need to do this one. Nothing is impossible in your life. So compared to the people say, okay, I can't get to this one, but there's always a proper procedure and things will come to you. But you have to avail that opportunity. For example, if I think I wouldn't have taken the opportunity for the locum role, because that time I have to travel nearly 6 hours every day to get to that prison and work there. That I did that job, but 6 hours every day travel for 3 months. But at the end of the day, I know that I am at a better place. So I mean to say, my point is that you have to be flexible. You have to take the opportunity. You have the thrill to do it. You have to be different in your life, whatever you're doing in your daily life.
So basically, you should be passionate about achieving something, and if an opportunity knocks the door, you should take it rather than thinking about how I'm going to commute. So this is what happens, obviously, when you go for it, and then it opens a lot of doors for the future prospects in terms of jobs for you, isn't it?
Absolutely, you're absolutely perfect, spot on.
Yeah, thanks. So guys, thank you so much for joining, and I really, really enjoyed today's session. And Mr. Smith, once again, thank you so much for being with us and sharing all these and answering to these questions. And I hope that you guys have enjoyed it as well. So last but not the least, I'm in Pakistan for a few weeks. So, feel free to reach out to me. I'm based in Karachi, but obviously I may travel across Pakistan if an opportunity comes. So looking forward to see you guys. And I will be doing a few sessions in a few universities in Karachi. So don't forget to come and join me. And if you're willing, and if you have a pharmacy, then if you think that it's good that if I come to your pharmacy to show how the clinical interventions are done, feel free to reach out to me, because I don't have a pharmacy here. So even if I want to do it, I can't do it. So it'd be nice if somebody comes to me and say, look, I've got a pharmacy and we've got prescription, if you can show it, how we do interventions. But back in the UK, I can show it to you guys, and for the purpose of learning and obviously sharing my experience with you. So once again, thank you so much, and I shall see you in the next session. Thank you. Assalamu alaikum. Allah Hafiz. Thank you, Mr. Smith. Thank you. Bye.